Are all coronavirus cases being reported? The pandemic is spreading rapidly, but some countries still don't have the capacity to test people. So is that hampering efforts to curb the disease? This is Inside Story. Hello and welcome to the programme. I'm Peter Dobbie. Now, the number of people infected by COVID-19 is more than 700,000 globally. The number who've died, over 34,000. Those are the estimates from Johns Hopkins University. But do those figures accurately reflect reality? If we're talking about pure maths, curves usually indicate how severe cases are in a country and they show its ability to control a crisis. But there are other factors too. Governments denying risk. Facts suppressed, a lack of access to poor people and limited testing. But be it in the slums, the townships, countries suffering conflicts and those without democracies, what is unknown is whether the outbreak is bigger than politicians are admitting or they're able to handle. Our correspondents in Beijing, Johannesburg and Mexico City report now on the situation across Asia, Latin America and Africa.
Here in Asia, some experts are doubting the low numbers of infections some countries are reporting. Myanmar and Laos have reported fewer than 20 cases each, while Cambodia and Vietnam have confirmed less than 200 respectively. And all these countries border or have close cultural or economic ties with China, the original epicenter of the outbreak. Meanwhile, Indonesia, Thailand and Malaysia have confirmed cases in the thousands. But experts say even these numbers are unrealistically low and not enough testing is being done. And here in China, local transmissions have slowed to a trickle in recent days, casting doubts over the accuracy of government figures, with some saying officials are underreporting, facing pressure for the world's second largest economy to get going again.
The township of Khayelitsha in Cape Town is the first in South Africa to report a case of coronavirus. There are many who are worried that the government will struggle to contain the spread of this disease in high-density areas such as townships and informal settlements. If that happens, it's likely to overwhelm the already strained public health system. Millions of people in these townships and informal settlements live in cramped conditions. They live in shacks where there's limited access to water and sanitation. Entire families often live in one- or two-room structures where social distancing is not an option. Now, South Africa has reported its first case of the coronavirus about 4 weeks ago. Now there are more than 1,200 cases. The government has been transparent when informing the public of the number of cases or spreading awareness, but people are still worried it won't manage to control an outbreak in high-density areas.
Across Latin America, several countries have been criticized for taking a more relaxed approach when it comes to containment of COVID-19. A few countries come to mind. Here in Mexico, for example, authorities only recently began recommending that people stay home and self-quarantine. The same is true in Brazil. President Jair Bolsonaro of Brazil is one of the most reluctant world leaders in terms of implementing stricter efforts. He's even criticized governors of states in Brazil for adopting more aggressive policies. Another country that comes to mind is Nicaragua, a country where you could still go outside and watch a football game. The policy there from authorities has been little more than burying their heads in the sand. So apart from the lack of preparedness for a contagion of this size and a certain lackadaisical attitude from several world leaders, there are concerns that Latin America as a region is a ticking time bomb for contagion. Manuel Rapalo for Inside Story.
Okay, let's get going today. Joining us from Johannesburg is Mark Heywood. He's a human rights activist and editor of the Daily Maverick's Maverick Citizen section. From New Delhi, we have Aaron Kumar, an economist and professor at the Institute of Social Sciences. And from Harare, Hopewell Chinono, an award-winning journalist and documentary filmmaker. Gentlemen, welcome to you all. Mark in Johannesburg, coming to you first. In amongst all of the death, in amongst all of the illness, is there another casualty, and it's the truth of what is actually happening out there?
Well, I think in South Africa, at this moment at least, the South African government is being very honest and doing its best to keep the public informed of the number of infections. We are told every day of the increase day on day and of the number of deaths. I guess the problem that we face here is that our testing is still at a relatively low level. There's only been less than 20,000 tests that have been done. So the figures that we're getting are not reflecting the truth of the rates of infection, particularly amongst our communities in South Africa. I hope that it will stay that way, because at least here we have a strong civil society and a strong human rights-based legal framework. But that may not be the case in countries to the north of South Africa.
Arun Kumar in Delhi, accurate data collection is vitally important. Would it be fair to say if we don't have that moving forward through this fight against the coronavirus, that undermines what's going on, if only as a public health issue?
So you're right, accurate data is very essential. But in India, we have, 94% of the workforce employed in the unorganized sector, from which the data is hardly available. And we only treat the organized sector data as the data representing the unorganized sector as well, which is actually not correct. So what's happening is that, the unorganized sector workers, which are very poor, they're migrating in large numbers back to their villages, because the work has ceased all over the economy as lockdown has been ordered 5 days back. So we don't have the data with regard to how many people are moving back and carrying the disease back to their homes. The testing has been very inadequate. We don't have enough kits. So our protocol has been that we're only testing those who've come from outside and those who've been in contact with them. But we're not testing, in general, other people to figure out how many people have actually contracted the disease already. And what's happened is that as lockdown was ordered, large number of people started gathering to go back to their villages, and maybe they have spread the disease further amongst them. And as they go back to their villages, the danger is that they would infect the villagers as well. And, there the health facilities are very poor. So it would be very, very difficult to take care of the spread of the disease if it goes into the villages. That's why many people have argued in India that it would have been better to keep the workers of the unorganized sector in the cities itself, provided them with food and so on, because they don't have incomes anymore to buy their food. Their medical facilities are very rudimentary, so it has been suggested that the test should have been done free so that people can come forward if they have any symptoms of this kind. So in other words, it's the unorganized sector of the country from where the data which comes out is very poor, which is a problem that we are facing. And therefore, we don't really know how far it's spread already.
Okay. Hopewell Chinono in Harare. Do those issues, as outlined by Arun and Mark in Joburg and Delhi, Hopewell for you, does that all serve to undercut a starting point of trust?
That is very true. The story from Delhi and from South Africa, they're slightly the same with what we have, but our situation is much worse than South Africa. For instance, we've only had 194 tests, and 7 people have tested positive, and 1 person died. And the citizens have been asking for the government to do more tests in order to get a clear and better picture of how far this infection has gone in our society. And the story from Delhi is also similar to Zimbabwe, because the president ordered a lockdown, but we don't have a safety net for our citizens. 90% of our potential workforce is in informal employment. We only have about 10% informal employment. So when the lockdown was ordered, most of them rushed to take buses to go to their villages because they cannot afford to stay in the cities. And the fear, like in Delhi, is also that those people that have gone to the rural areas are going to infect the people in the rural areas, and then we'll start to see the pandemic becoming much, much bigger than what we would like.
Mark Heywood in Johannesburg, where you are, is the default knee-jerk reaction on the part of the government and the health ministries and the health officials? Is the default setting complete transparency, or we need to manage the situation and perhaps massage the figures or keep them slightly off the radar?
Well, I do think, and it's probably very different in Zimbabwe and India, but at this stage, at least, the default position is complete transparency. I can't fault our government at this stage. The problem is very similar to India in the sense that we're not testing the people who are most at risk. This epidemic started with travelers, but has now moved into our communities. And the effect of the lockdown is precisely what has been described in Zimbabwe and India, which is that many, many thousands of people have left the cities to go back to provinces that were relatively unaffected. A few days ago, the numbers were much smaller, but people have gone back to their homes and to their homesteads. And the other thing that I think is critical is that transparency is not just necessary with regard to numbers of infections, of numbers of deaths, but transparency is going to be critical in terms of what government tells us about what it is doing to mitigate this crisis. Because in South Africa, there are millions of people who are living in overcrowded conditions in informal settlements, who don't have continuous access to clean water. So they're unable to wash their hands. They're unable to practice the social distancing, which is the standard recommendation of the World Health Organization. So, and they're unable in this situation of lockdown to get access to basic food and foodstuffs. So the big challenge is going to be what level of transparency will there be around measures to make sure that water and food and so on reaches the poorest communities. And I think an issue that will become serious later on is how transparent will the government be about the reactions of the police and the army in a situation where people are feeling incredibly insecure and incredibly fearful, and which is therefore creating, I think, a volatile and dangerous situation as far as peace and social stability is concerned.
Arun Kumar in Delhi, when Mr. Modi addressed the nation on March the 19th and announced a task force to deal with coronavirus, do people trust him to deliver on that? And do they trust him to get his message of social distancing out there when you've got so many hundreds of thousands of people literally walking hundreds of kilometres from where they live and work to where they come from?
So I think there is a trust deficit because in India, governance is very poor and corruption levels have been very high. So the public, I think, does not quite believe, that the government would be able to deliver. And that's why as soon as the lockdown was announced, people started rushing back to their villages rather than staying back in the cities. As is the case in South Africa, the living conditions of vast majority are rather poor, with 4 or 5 people crowded into one room, lack of clean drinking water and clean water to wash hands, not enough soap, etc., no income to buy food, etc. All those problems are very severe. And that's why even though the government has announced that they'll provide food to people wherever they are, people are still trying to rush back to their villages. They've got a lot of fear in their minds. Now, the economic panel that was formed, that has not yet given its report. But what has been done is that one, announcement has been made for the concessions to be given to the poor people, to the unorganized sector. But that is rather tiny, in comparison to the losses that have already been suffered. It's about 0.85% of the GDP, which is very small compared to the losses that the poor people have already suffered. And there also the problem is that many people believe that delivery is not going to be easy, and especially to the people in the unorganized sector who have migrated from rural to urban areas. And there's a large amount of migration every year from rural to urban areas and back to the rural areas.
Yeah, but Arun, just allow me to interrupt you for 30 seconds, and please keep your answer brief because we're running towards the end of the programme. According to Johns Hopkins, the website, the trusted website, as of now, in a country of 1.3 billion people, there have been 29 deaths so far. If it looks too good to be true, it generally is too good to be true. So who's doing what with the figures there?
So, I would say that the 29 figure is probably all right at this point of time. But what we are worried about is the explosion that may take place as the community spread increases. And we had the first 500, cases over about 45 days, and the next 500 cases in 5 days. So the number may explode, especially with a lot of people crowding together and migrating, very quickly. So I think that's the real worry, that in the next 10 days, it might explode. And that's why the government ordered the lockdown, because the worry was that it should not be allowed to explode. If we are able to manage to keep it down, I think the government would get a lot of credit, for ordering it down early.
Hopewell in Harare, coming back to you. The starting point for the fight against coronavirus in your country was pretty difficult anyway. 12% of the population are HIV positive. 7 million people, that's half the population, are classified by the United Nations as basically living in poverty anyway. So when it comes to those people looking at the government and saying, yes, the government can look after us properly, what's their reaction to that?
It's a total disaster in Zimbabwe because 1.4 million people are living with HIV and positive. We have people who are elderly, they have high blood pressure, some are asthmatic. And as we all know, that the 5% of the total number that gets infected is going to need special care in ICUs. In Zimbabwe as a whole, we only have 7 ventilators for the whole country in the public sector. And none of those ventilators has been deployed towards corona. In fact, the only person that has died so far, who's the son of a millionaire businessman, could not even get access to a ventilator. If he had a ventilator, he would have lived. Now, if you come back to the issues of food and the general malaise in the country, the government has not been able to tell us what it's going to do. Transparency has been a problem. We have not been given figures of how much has been deployed. The task force which the president has set up, the deputy chairperson has got an image problem. She's the lady 2 weeks ago who came out and said corona is a punishment from God to the Americans for imposing sanctions on Zimbabwe. So there is that lack of trust between the citizen and the government is not doing much to try and mitigate that. The health minister is absolutely incompetent. He's a qualification fraud. He says he's a doctor. He's not a medical doctor. You don't need to be a doctor to be a minister of health, but there is an issue of integrity. So there's trust which is broken down between the doctors and the minister of health. Right now, as I'm speaking to you, all our doctors and nurses are on strike. They've said they will not go into hospitals if they are not given personal protective equipment.
OK, let's go back to Mark Heywood in Johannesburg. Mark, your own newspaper, the Mail and Guardian, has been doing some number crunching, I see, on its website. It says if you look generally across the planet, the growth rate is 13%. So if one person has it today, 1.13 people have it tomorrow. Because of the curious ways that people live differently in the townships in South Africa, the growth rate they're predicting could be as high as 57%. That means in 4 weeks' time, South Africa needs to find medical care for 100,000 people. Can it do it?
Well, no, it can't. That is the simple answer to that. Our health system is probably one of the best public and private healthcare systems in the whole African continent. It's certainly far, far, far better than Zimbabwe's. But we recognize here that we will be overwhelmed very, very quickly. I think that we have, it's believed, 6,000 or 7,000 ventilators in South Africa. But there are going to be an order of magnitude much higher than that of people who need ventilators. You know, the problem that's common to India, Zimbabwe, and South Africa, as you're hearing, is that once this virus gets into poor communities, because of the conditions in which we live, it will spread incredibly fast because it's very difficult for people to protect themselves and to protect others. That's the first problem. And the second problem is that we have countries with high HIV, high tuberculosis, high diabetes, high hypertension, whole bunch epidemics of pre-existing conditions that will predispose people to the serious illness parts of COVID-19. So we're not there yet. We started a little bit later than Europe or Asia. But if this virus behaves in India, Zimbabwe, South Africa in the same way as it's behaved in Italy or Spain or China, we are facing a disaster of terrible proportions. And I would be hoping that developed countries, which have a great deal to do with the mess that certainly we're in Africa, in terms of our underdevelopment, are beginning to discuss emergency relief packages with no conditions attached to those packages, because decades of development in our countries could be undone in a matter of months if the worst case scenarios are what actually plays out in the weeks, literally in the weeks ahead.
Arun Kumar in Delhi, to simplify one aspect of the story of India over the past year or so down to its most basic, at some point, somebody will get into Kashmir. Lots of people in Kashmir don't trust Narendra Modi anyway. Why should they trust him to look after them when it comes to the coronavirus?
So you're right that Kashmir will pose a specific and a special problem as far as the Indian subcontinent is concerned. And, there, for their own good, I think, they would have to rely on the state, because at this point, there's no option. And that's why one of the former chief ministers who was released from prison, after about 7-8 months of incarceration, he said that I'm not going to do politics till this, situation is under control. So I think, various political parties at this point of time recognize that they have to cooperate and they have to act together. India has 31 different states and union territories, and each one has a different model. But by and large, there's cooperation going on. And yet, as in South Africa, the medical facilities are very poor. The government is trying to gear up. It's using, for instance, railway coaches, converting them into hospital, facilities. Schools which are closed and colleges which are closed, they are being used to, take people there in case, situation goes out of control. There's a plan to also use the community centers in the villages to isolate people. There are also plans, to use stadiums, etc. And also draft in medical students who are studying, because we are very short of medical personnel. There's also a move to see that the less, sort of stressed doctors,
okay.
like,
Arun, I'm going to interrupt you again. I apologise. I just want to take the last point to Hopewell Chinono. Hopewell, for you, when you look at the people that run your country, when you look at the health ministry, when you look at the doctors and the nurses, what's the point in the government being publicly proactive if they are, in effect, blindfolding themselves, but also blindfolding the people who live and work there, who are Zimbabwean?
My plea to the rest of the world is actually that please come and help Zimbabwe. We've got a corrupt government, we've got a broken health delivery system, and we've got a fragile society. If we do not get international help, we are going to have a catastrophe of biblical proportions. If you look at what happened in Italy, in Spain, and what's happening in New York now, these are countries with solid health delivery systems, first-class health delivery systems, but they are struggling. How are we going to survive with 7 ventilators? How are we going to survive with doctors who are going to be on strike for as long as they don't have protective clothing? Please come and help us. That's my plea.
Gentlemen, we have to leave it there. Thank you so much for your thoughts over the past 30 minutes. Thanks to our guests. They were Mark Heywood, Arun Kumar and Hopewell Chinono. And thank you too for watching. You can see the programme again anytime on the website, aljazeera.com. And for further discussion, do check out our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter at AJ Inside Story. From me, Peter Dobbie, and the team here in Doha. Thanks for watching. I will see you very soon. For the moment, bye-bye.